All right, so our patient, who was super awesome, came from out of town, had a comprehensive full face rejuvenation, but we're just going to show an updated photo of her eyes. And this is just a few days after surgery, so she's definitely swollen, but her eyes are already looking great. What do? We did a brow reset, or a lateral brow lift with a reset. So again, brow lifts, everyone thinks we're going to go straight up and make them look surprised all the time, and that's not the goal, especially if you never had really high brows to begin with. So we just want to naturally get this weight off that causes that hooding on the side of the eyes, on the upper lid, as well as when we do our deep plane facelift, you get bunching here. So doing this full kind of lateral release helps everything transition up vertically. So it helps with the upper lids, but also helps with the mid-face portion of a well-done, extended deep plane facelift. So we have a nice conservative lateral brow lift. We have an upper eyelid blepharoplasty, which involves not just removing extra skin, but contouring orbital fat, repositioning that fat so we can maintain that volume here and not hollow you out. And then these additional little steps like doing an internal brow pexy, doing a lacrimal gland repositioning, a lot of steps that get skipped a lot when you're trying to just knock your upper eyelid surgery out in 15 minutes. It takes us much longer to do that because we're comprehensively really trying to address it so that you get a nice long-lasting result, and not relying purely on skin and muscle removal, which leaves patients with issues like lagophthalmos, not being able to fully close their eye, dry eyes, that sort of a thing. And then the lower lids, which is the toughest part. Lower eyelid surgery can be very simple, where you just kind of go and take fat out. But in cases, especially once we lift the cheek up, sometimes there's extra skin here that we have to remove. And transcutaneous, going from the outside lower blephs, is considered more of an old school technique in many ways. It is easier to do a simple version of these because you kind of cut through skin and muscle, go down. It's easier to access the fat, but the rate of lower eyelid retraction after these issues, after this sort of a procedure, is way, way, way higher. So on patients that hey, there's not much extra skin here, it's more of a skin quality issue, not a quantity issue. We want to go from the inside of the lid, contour and reposition that fat, and then do laser on the skin, maybe a skin pinch on the skin flap on the skin, and some fat grafting for the volume loss. In this case, we did more of a transcutaneous approach, which allowed us to address the fat here. We did fat grafting here, but we were able to lift the cheek and the muscle, get a great suspension here, not change our eye shape unless we wanted to revolumize the lid and have really good volume afterward.